COVID, unfortunately, is back in the US, and more and more cases are being reported. More and more cases of long COVID are being discussed, and how still in the US, so many Americans are influenced by online misinformation through Facebook, through other forms of media, and they resist vaccinations and masks.
COVID spread, it took many lives, caused lots of problem. I don't have to go through all this. We've all suffered enough for the last 3 years, or actually more than that. Lekin the COVID is coming back. The incidence is going up again. Right now, as of last week, the numbers in New York are that we've had 1,275 cases per thousand, which is about like 10%. The variant which is right now common is EG5, which is of course in itself a variant of the Omicron. The new variant that is coming now is called BA 2.86. Now this variant that is now, as of August 30th, we have seen it definitely documented in 4 states in the United States, has 30 mutations already.
One conspiracy theory that I have come across, in fact, I know a gentleman of Pakistani descent who keeps on sending these long emails to me, in which he says that the vaccine is actually a conspiracy by the government to track us. So tell the viewers about that these vaccines are safe.
People who themselves eventually showed up and took the vaccine were trying to spread rumors, and I knew these people, saying that they are going to put a chip in you. You're going to have a chip in you. I mean, I was surprised. I mean, so they're going to start putting free chips in us, and you are going to be, they're going to be able to monitor you. They are going to be able to do this to you, do that to you. It was shocking. The big thing among our South Asian community has been, and that includes family members, who have become convinced that if they give the vaccine, especially to the girls, their fertility is going to be completely rendered nil, and they are not going to be able to have children.
Hello and welcome to Global. And I'm really delighted to have Dr. Zoovia Hamiduddin with me, who is a long-time medical practitioner. She's MD and based in New York State, and her specialization is internal medicine. Dr. Zoovia Hamiduddin is an active member of the community here in New York, but also a writer, also comes from a very literary background. But today we will talk more about medicine and public health. And the reason I invited her and took her time was to do with the fact that COVID, unfortunately, is back in the US, and more and more cases are being reported. More and more cases of long COVID are being discussed. And while we were talking, I heard Dr. Zoovia mention the attitudes towards vaccination, and how still in the US, so many Americans are influenced by online misinformation through Facebook, through other forms of media, and they resist vaccinations and masks, and how important it is for immunocompromised, for the elderly, and for everyone to exercise caution. It is not just about one's individual health, though that is important, but for the public health, for the public good. So, welcome, Dr. And maybe you can talk a bit more about your experience as a medical practitioner, as a doctor, what you go through on a daily basis in this regard.
Thank you so much, Raza, for having me on your show. I am, I just want to point out, मैं इस बात की वजह करना चाहती हूँ कि I am speaking from New Rochelle. New Rochelle was at one time the epic center of COVID. This is where patient zero was. This is where Governor Cuomo, who then became a voice for prevention and treatment of COVID almost all over the world at that time, he was being followed, spoke about and had put a parameter of 1 mile radius, which obviously was not enough. Because COVID spread, it took many lives, caused lots of problem. I don't have to go through all this. we've all suffered enough for the last 3 years, or actually more than that. Like the COVID is coming back. The incidence is going up again. Right now, as of last week, the numbers in New York are that we've had 1,275 cases per 1,000, which is about like 10%. 10% population. When 10% of the population start getting COVID, we do start showing some concern. The variant which is right now common is EG5, which is, of course, in itself a variant of the Omicron, and the new variant that is coming now is called BA 2.86. Now, this variant that is now, as of August 30th, we have seen it definitely documented in 4 states in the United States, has 30 mutations already. And each mutation is an evolutionary process on the part of the virus, which becomes, in layman's term, we can say it becomes more stronger, or rather, we should say it becomes more lethal, more able to penetrate, more able to cause damage, So,
Right.
just for trivia's sake, BA 286 is being called Prola. Basically, they're getting the name for it by using the Greek letter pi and rho. So we're calling it Pirola. Pirola is what it's being called. And as I said, it has about 30 variants, we do check waste matter, and the waste matter has shown that the incidence is indeed going up. The incidence in the whole of the United States is anywhere from 17 to almost 25%. They're seeing these incidences of COVID. Most of them are they do not require hospitalization. So that's the good part. It's important to remember that this has happened because of herd immunity. We have developed a herd immunity because by getting the infection and by getting the vaccination, Except that with the new virus, new mutants that are coming, it is important that we get revaccinated. Most of us have not been vaccinated for close to a year.
Yes, including myself. I'm going to get an appointment soon.
The new vaccine is supposed to come out in the middle of September. Today is what, the 16th?
Yes.
I think that we need to get it out as quick as possible, so that it can be given to all. Now, so I would like to talk about what is happening right now with the virus, and also to talk about what has happened politically,
Yes.
So
Before you go further, Dr. Zoovia, I just want to tell the viewers that thousands of cases, as Dr. Hamiduddin said, thousands of cases have been reported, and in certain cases, in places like Nebraska, the positive rate has been 13% plus. And it's a large.
It is 17 to 25%. I mean, that's a pretty significant number.
Yes.
1 in 4. We are not even saying 1 in 10. They're getting positive. The good part is, as I said, herd immunity. The second good part is that we have medications like Paxlovid, which has been a great blessing. It is produced by Pfizer. It has proven itself to be by far the best. It really does make a difference. It is best if it is taken in the first 5 days after the symptoms start. So, delaying it is not a good idea, and it definitely helps. So the booster, as I said, is extremely important. Prevention is, again, we can't emphasize enough. Prevention means masks are not a bad idea, particularly to those who have lowered immunity because of their age or because of whatever factor. If the incident goes up to about 20%, in any particular state, we definitely would like to bring the mask back. Actually, even before that, people will have to make the decision, because at this point, whether these are medical administrators or whether these are politicians, they do not want to make this decision. The important thing is to get vaccinated, wash your hands, wear the mask. This we know is a foolproof method. The mask should fit you tightly. N95s are easily available, At this point, it's not like it is not available, And so that is what I was going to say. Now, the main thing here is, as you had mentioned, that, that the social medias have not been, have not been, how shall I say it, they are not regulating what they are putting on at all. With the net result that there has been all kind of conspiracy theories, there have been all kind of fake science that is being distributed, If you have any questions, I would say, please talk to your doctor and try and get the information. Now, the problem has become that people have started mixing politics with prevention. Governor DeSantis has decided to distinguish himself, and I'm not just, this is all over the paper, so I'm not just talking through my hat, so to speak of, in which he has said very clearly that he is not going to subject his constituents, which means Florida state residents, to either masks or to vaccination. The younger population under the age of 65, he is basically going to support the decision not to mask and not to get the vaccination. This is the political reason for which he's doing it, because he wants to distinguish himself from President Trump, who at one level he also supports. I mean, he has said it very clearly that if he is the choice of the Republican Party, he will vote for him. But this is becoming like a distinguishing factor that he's working on,
Yes.
But I think that we all have to be cognizant of all of these issues, social media, vis-a-vis the fact that we are also so done with it. We keep hearing it, even comedians, and rather, I don't know what to call them, like somebody like Bill Maher, who says, I'm so done with it. I don't care. Everybody should go and get it, more or less. Except that there is long COVID. It is causing problems. At one time when COVID first came, most of the population that suffered the most was the minorities, the Hispanics, the Blacks. Right now, and there were not too many people, say, for instance, in Massachusetts who were suffering from it. But this time around, we are seeing it in our elderly population. And the administration of institutions, including some of the SNFs, which is the skilled nursing care facilities, rehab facilities, are very reluctant and almost hesitant because of the political pressure to start emphasizing that it is time to take measures such as wearing the mask again. According to NPR, which was day before yesterday, they talked about how the Veterans Administration nursing home facilities in New Jersey, these are huge, and they had come under criticism previously also, are once again showing a higher incidence of death of the residents of these facilities with COVID, that is, than other institutions. And this has to do with, to a large extent, because of poor administration, not proper checks in who's coming in and going out, and of course, not wearing the mask,
So, Dr. tell us, how do you deal with your patients when they come in with all these ideas from Facebook or Twitter and other sources? I'm sure there are arguments when you tell them get a vaccination or get a mask, etc. How do you deal with that as a medical practitioner? I'm sure it's tough.
It has been a learning curve. I thought I knew how to practice medicine, but you keep learning new things, just like we had to learn about AIDS, and we had to learn about the swine flu, and then about the West Nile, and now we have learned about COVID, and it's always done, when you are running at full speed, and you have to learn all this too. So, I've always used the direct approach. And as I said, I have been in practice in the same place for a long time, and I thought I had good relationship with patients. But obviously, however good my relationships may have been with them, it is not equal to the social media, whoever they are. Yeah. They trust what they're seeing, some stranger tell them on social media. So the direct approach, I found out, was totally backfired. They do not want to hear that. You have to stand there. It's a consumption of time, and nod your head and kind of listen. In the beginning, and it's very interesting, because as I'm developing new methods of how to communicate with them, they're developing new methods on how to convince me that what I am saying is incorrect. Dr. Google, I can't even say it's Dr. Google. This is Dr. Social Media, conspiracy theory. I've had patients who live here in Larchmont, go all the way into deep New Jersey, into horse country, to get treated by a veterinarian. I'm not making it up, because for a while, one of the theories that was being promoted was that this horse deworming medication is the one that you should take. Now, why would somebody who I've taken care of for 30 years want to cross the GW bridge, drive 70 miles off, go to a veterinarian and take a medication is beyond me. I mean, I think we have to do, you're into media, so you'll have to do some study as to and understand that your influence is far greater than a person who's sitting directly in front of a person physically.
Unfortunately, Dr. Hamiduddin, one of the problem has been these conspiracy theories that you mentioned. But one conspiracy theory that I have come across, in fact, I know a gentleman of Pakistani descent who keeps on sending these long emails to me, in which he says that the vaccine is actually a conspiracy by the government to
Yes.
trap us. So tell me, tell the viewers about that these vaccines are safe.
So when the vaccines came out, the saddest thing is that we have lost people that I knew. As I said, it started in New Rochelle, and we really wore the brunt of it. Just like Brooklyn, where my daughter practices, really they wore the brunt of it. Park Slope area and all of those, even the fancy areas, they did. The amount of deaths that we saw, the fact that we had freezer truck outside where the bodies were being placed, the fact that we lost our colleagues, uh, nurses, social workers, physicians, at that time no vaccine was available. So the conspiracy theories are especially against the vaccine, and a lot of them, it's very interesting. It has brought out, perhaps it was because we were locked up, I'm not quite sure, people who themselves eventually showed up and took the vaccine were trying to spread rumors, and I knew these people, saying that they are going to put a chip in you. You're going to have a chip in you. I mean, I was surprised. I mean, so they're going to start putting free chips in us, and you are going to be, they're going to be able to monitor you. They are going to be able to do this to you, do that to you. It was shocking. The big thing among our South Asian community has been, and that includes family members who have become convinced that if they give the vaccine, especially to the girls, their fertility is going to be completely rendered nil, and they are not going to be able to have children. And I've had conversations with them, telling them that from the time, even before conception, the number of eggs that a young girl or baby girl or whatever you want to call it is going to have are there. There's nothing, I mean, short of radiating that baby or doing something else, the vaccine is not going to do anything. But this has become a big factor, particularly in South Asians, where they feel that they are going to interfere with their children's, let's put it like this, that the children will be rendered unable to have children of their own. And they don't want to take these responsibilities.
Yes, but but here in the United States, I mean, I often, sometimes I now Facebook has tried to clamp down on these theories, but I've seen myself, these terrible ideas about this, how
Yes.
bad vaccine is, it's going to damage you, it's going to damage your thing, and etc., etc. And all the doctors I've spoken to in the last 2, 3 years, Dr. Zoovia, including yourself, vouch for the scientific research that has gone on. So, I mean, how do we, I mean, can doctors start, I mean, at the community level, maybe have more community communication, better information to overcome this propaganda,
I think the propaganda element starts with the deregulation, the yellow journalism that is no longer, there's no such thing as that. I was reading in the New Yorker about one of the comedians, I think his name is Hassan Minaj for that instance. And I like him, don't get me wrong. And they're talking about the fact that the lines between truth and untrue have become blurred. So you can kind of mix up stories to get the effect that you want on your viewer. I do appreciate what he's saying, because he's really an artist and a performer. And performers will very often take several stories together and put them together to come up with one cohesive, sort of a scenario and give it to you. Except that at this point, because with the advent of social media, it seems to me that everybody thinks they have become an artist of some kind. They all think that they can imagine things, that they can start putting facts and fictions together. Almost all of these kind of, especially the conspiracy theories, are put forward by people who will say, I know it happened to me, or it happened to my mother, or it happened to my father, or it happened to somebody I know. So it's, obviously anytime you these are kind of anecdotal. People don't understand what science and what is science and what is an anecdote. But also people do, the personal mention always gets much more attention as opposed to numbers, Partly it has to do with our own education system, which has failed us.
Yeah.
The fact that the foundation for science, for civic responsibility, there used to be a subject called civic that used to be introduced and used to be talk about how to be a good citizen, what it entailed, our own how shall I say, the fact that the United States itself had cut off the amount of monies that had been allotted for preventing pandemics. It wasn't even that much of monies, that made a big difference. Prior to the advent of COVID-19, for instance, when we had something like Ebola, not just the United States, but it is a big major contributor to the WHO also. When they heard that any kind of an epidemic or pandemic, or before they became a pandemic, started anywhere, the biggest thing the United States always did was, and I am specifically talking about the US here, other countries also did that, was to promptly arrive there as gift-bearing, well-wishers, which would include hazmat suits, which will include all kind of things, try to contain the infection wherever it was. So when this infection became, finally the WHO, it was on the 27th of December, actually by November, the rumblings had started, 2019. By the 27th of December is when WHO said, yes, this is taking place and it's going to be a pandemic, et cetera, et cetera. So it was kept under, how shall I say, it was kept cloaked for a very long time. And of course, the responsibility of the Chinese government and of China cannot be, how shall I say it, I cannot.
Yeah. I mean,
we can't condone it and we can't say that they are not responsible. But, almost all of these big powers, let's face it, we all, the common vernacular, we will say that we do have spies everywhere. And our spies or our people who gather intelligence gatherers, so to speak of, that we send with our embassies are not just looking at what they are doing in their, education department of science or political, but we almost always have kept intelligence gatherers for what is going on medically, what is going on, because that's important. That's an important point to understand, because part of our defense budget, which is huge, is supposed to defend us also from infections, from pandemics, from all kind of, how shall I say it, all kind of calamities that will cause harm to the United States citizens. So that emphasis was kind of removed. Usually they are attached as liaisons to the American embassies. They're given some kind of a title, they'll be given some kind of a PR title, and their job basically involves in entertaining and getting to know the people. A lot of them are going to be either physicians or somebody with some kind of a scientific background, but that was just not done. So basically we also had our eyes closed, our ears closed, because I don't know whether it was because we didn't have enough people there, probably didn't have enough, or they weren't doing what they were supposed to do. I'll tell you something very interesting. My oldest daughter works for a large American institution. And actually she was the first one. She's an investment banker. So she was the first one who mentioned to me, saying, "This is coming, mom, this is coming, this is going to be big, this is going to cause big financial." Of course, she was thinking in terms of finance. So, more than the medical community, more than the scientific community, more than our defense,
Yeah.
it was American finance that was trying to ring the alarm bell.
Yes.
So that is a big failing that we have not addressed. It's so much easier to start pushing Asians in front of trains, or start stabbing them, or attacking. This has all happened. I'm not saying something that has not happened. But
Correct.
we have to sort of look at our own self and understand, how did we reach this point that we didn't know what was going on? Why did we reach this point? What are our feelings, and how can we prevent this from happening? I'll tell you something very tiny, but it's very important, that Henry Schein, which is a great, I'm not criticizing Henry Schein by any means. I am the customer too. Every medical institution, whether it is Walter Reed, or whether it is a small doctor's office like myself, or whether it is a big institution like Presbyterian, we all are customers of Henry Schein. Henry Schein has an exclusive on buying a lot of things, and they do a good job. So for the masks, we have depended 100% on China. 100% on China. Henry Schein has a contract for the next, yes, for the next, like, it was 10 years when it first came off, so it's probably another 7 years that they will only buy from China. Under President Obama, there were factories, or whatever you want to call it. I mean, they're not even really that complicated, factories in Kansas, etc., that were given a guarantee, because when the mask thing came up, that yes, we will always buy from you. You keep making it, we'll keep it in storage. But we kind of reneged on that. And those people who had invested in putting up these factories really suffered. Some of them declared bankruptcy. So there was nobody making masks. It's not enough to say, you just make a cloth mask, which became like a big cry. I'm going to make it. I'll show you how to do it. No, certain materials is needed to stop the virus from
Yes. Exactly.
invading your respiratory system. I mean, there have been so many mistakes made with this virus. We should learn from this.
We
Uh,
should absolutely.
we,
Dr. Hamiduddin, to end because our show has a limited time. So
yes, it was
I
such a
think
pleasure. I,
it's yeah. Go on, please conclude.
I was just saying thank you so much for having me on your show, and I hope that I've made people think, at least, even if I haven't convinced them. I'm hoping that they have started to think a little bit, and become cognizant that there are other sites that they can look at: CDC, New York State, any other. It's a pleasure. Take
Absolutely.
care.
Thank you, Dr. Hamiduddin, and we'll keep on talking about other issues as well. Goodbye.
Yes, absolutely, we will. Take care. For the office. Take care.
So, viewers, you just heard Dr. Hamiduddin speak about COVID, long COVID, the urgency of masks and vaccination. And I hope this video will do a little bit in countering the disinformation that we have about COVID and about public safety and public health. And please share it, and please tell everyone to wear a mask, not just in the US, but in Europe and other parts of the world, because we are still not done with COVID. And with that, goodbye.